A brain hemorrhage is a type of stroke. It's caused by an artery in the brain bursting and causing localized bleeding in the surrounding tissues. This bleeding kills brain cells. Brain hemorrhages are also called cerebral hemorrhages, intracranial hemorrhages, or intracerebral hemorrhages. They account for about 13% of strokes. Since some brain hemorrhages can be disabling or life-threatening, it's important to get medical help fast if you think someone is having one. Here's what you need to know about the causes, symptoms, treatments, and more. What causes bleeding in the brain? There are several risk factors and causes of brain hemorrhages. The most common include: 1. Head trauma injury is the most common cause of bleeding in the brain for those younger than age 50. 2. High blood pressure. 2. This chronic condition can, over a long period of time, weaken blood vessel walls. 2. Untreated high blood pressure is a major preventable cause of brain hemorrhages. 3. Aneurysm. 3. This is a weakening in a blood vessel wall that swells. 3. It can burst and bleed into the brain, leading to a stroke. 4. Blood vessel abnormalities. 4. Arteriovenous malformations, weaknesses in the blood vessels in and around the brain may be present at birth and diagnosed only if symptoms develop. 5. Amyloid angiopathy. 5. This is an abnormality of the blood vessel walls that sometimes occurs with aging and high blood pressure. 5. It may cause many small, unnoticed bleeds before causing a large one. What are the symptoms of brain bleeding? The symptoms of a brain hemorrhage can vary. They depend on the location of the bleeding, the severity of the bleeding, and the amount of tissue affected. Symptoms tend to develop suddenly. They may progressively worsen. The symptoms include: 1. A sudden severe headache. 2. Seizures with no previous history of seizures. 3. Weakness in an arm or leg. 4. Decreased alertness, lethargy. 5. Changes in vision. 6. Tingling or numbness. 7. Difficulty speaking or understanding speech. 8. Difficulty swallowing. What are the types of brain bleeds? Bleeds can happen inside the tissue of your brain or outside it. When they happen outside the brain tissue, they involve one or more of the protective layers, membranes, that cover your brain. Epidural bleed. This is when blood collects between your skull and the thick outer layer, called the dura mater. Without treatment, it can make your blood pressure rise, give you trouble breathing, cause brain damage, or lead to death. An epidural bleed usually happens due to an injury, often involving a skull fracture, that tears an underlying blood vessel. Subdural bleed. This is when blood leaks between your dura mater and the thin layer beneath it, called the arachnoid mater. There are two main kinds of subdural bleeds. Subarachnoid bleed. This is when blood collects below the arachnoid mater and above the delicate inner layer beneath it, the pia mater. Without treatment, it can lead to permanent brain damage and death. Intracerebral hemorrhage. This is when blood pools in the tissue of your brain. It's the second most common cause of stroke as well as the deadliest. It's usually due to long-term, untreated high blood pressure. If you are new at our channel, please subscribe our channel, it will be great support for us.